blindness. The signs and symptoms at first are noticeable on the skin, as there are lumps on the skin, chest, back, face, and stomach. There are also sores that are weeping. The lightening or depigmentation of the skin is another sign of the disease. Furthermore, the lymph nodes are swollen. The name river blindness comes from one of the signs of partial or complete inability to see. The incubation period for this disease is quite lengthy, as it takes months for major symptoms to appear, even though the larvae are still present in the body. This image shows a case of onchocerciasis that has inhibited the person from seeing. The larva can cause the cornea to become clouded over and ultimately not functional. Another way the infected person could become blind is through the inflammation of the optic nerve. The causative agent of the disease is Onchocerca volvus, which is a parasite. This worm is introduced into the human body through bites from black flies that live close to rivers and streams that move at a high rate of speed.
The worms can live for an extended period of time in the human body, sometimes even up to 15 years. These worms can produce hundreds to thousands of offspring each day. The worms can travel through the host body and muscles without provoking an immune response. This movement causes the itchy skin and rashes throughout the body. This image shows a slide of a worm that causes river blindness, which inhibits the person's ability to see. This inflammation is what leads to the blindness aspect of the disease. A trophy to the eye is simply damage being done by the larvae or the worms in the body.
The ability for the worms to stay hidden from the immune system is a product of the disease to disable or alter the helper T cell pathway in order to decrease the immune system regulation. This allows the disease to progress with little to no interference from the immune system, allowing the larvae to mature and the adult worms to grow larger. Also, the worm is able to stop the actions of the innate immune system, which stops the host's immune system from immediate action against the disease. River blindness is a common part of life in the tropical areas of Latin America, Africa, and Yemen. The infected persons of this disease almost all live within Africa. The larvae need to be near fast-moving water, so tropical areas are more common to see this disease. Usually one bite does not infect a person, but rather multiple bites are needed. This means people traveling to these areas for a short amount of time, like 3 months or less, have very low chance of contracting an infection. This image shows the process of infection from the black fly becoming a carrier of the larvae. Then the fly bites the host and the larvae are transferred into the bloodstream of the wound. These larvae then mature in the host and become adults and replicate. These microfilariae then travel back to the skin, and when a fly bites again, the larvae is ingested again. This fly is then ready to transfer to another host.
Surface area for the flies to bite, reducing the risk of infection. The treatment of this disease is a drug treatment for a long period of time to kill the larvae and adult worms. The ivermectin is given until the person does not have any signs of skin or eye infection. The downside of this drug is that it only kills the larvae and not adult worms. Doxycycline is used to inhibit the bacterial Wolfbachia found in the same region as O. volvulus, the treatment which causes severe side effects in these patients, so precautions are taken to avoid this. These are our sources, and we found them off the CDC website and also a scholarly document from the PLOS Medicine by Maria Gloria.